Hi, my name is Dr. Lexie Wang. I am a facial plastic surgeon at West End Plastic Surgery in Washington, D.C. Today on Face the Facts, we're going to be talking about a very serious but unfortunately common condition in my industry, and that's called Body Dysmorphia Disorder, or Body Dysmorphic Disorder, BDD. Now, this is a true psychiatric diagnosis in the DSM, which is the manual of all the different psychiatric illnesses. I'm going to caveat this by saying that I do not have training in this, so please don't take anything that I'm saying as a true diagnosis, but it is something important for everyone listening to be aware of, and that includes other physicians and patients. So the main criteria for a diagnosis of BDD is to have some kind of preoccupation with some kind of flaw in your body. And the flaw may be real or it might not be real, but even if it is real, it's usually something that's very, very slight, minimally noticed by anyone else. And some kind of repetitive behavior in regards to this flaw. So this might mean things like picking at it or constantly looking at it in a mirror, taking a lot of photos of it, basically just a lot of interest in this perceived or real flaw. Sometimes this also means things like constantly going after treatments for it, like seeing a plastic surgeon, which we'll get to later. To have the true diagnosis of a disorder in any kind of psychiatric condition, you need to actually have some kind of impact on your life in some way. So this does need to cause some kind of distress to you, either in impacting your social life, maybe you're not going out, maybe you're not seeing friends as much, or maybe it's impacting your job, you don't feel comfortable presenting yourself at work, things like that. And that indicates that this is a disorder as opposed to just having sort of symptoms of something like this. And the last thing, which is pretty common in all the psychiatric conditions, is that it's not explained by something else, like if you have a medical condition or whatnot. So the reason I wanted to bring this up is that it is something that unfortunately we see pretty commonly in plastic surgery offices. I think they say somewhere like it's maybe a rate of about 2% in the total population, but when you actually are looking at plastic surgery or cosmetic surgery offices, we're looking higher at around 10%. Up to even 20%, and in fact, they say of all the patients seeking nose surgery or rhinoplasty, it might even be up to 25%. So that means 1 in 4 of you guys coming to see me for a nose surgery probably has this. So just think about how common that is for a second. The sad thing about this is that these patients almost have no insight to the condition at all. And so they actually think that what they see is this horrible, glaring defect on their face that impacts, for example, their ability to make friends, have a relationship, go to work. And it's our job as a physician to help educate them that that's not the case. But most importantly, to help them get steered in the right direction of finding the help that they actually need, which is almost never plastic surgery, but actually some kind of mental help, such as seeing a psychiatrist or a therapist or something like that. So I just want to bring this up to everyone's attention that this is a condition, it's real, it's out there. I see at least, I would say maybe one person a week who kind of falls into that category. So it is not a rare condition by any means of the imagination. For patients, if you think this might be something you have, surgeons, if this is something you're starting to have your intuition, your ears are perking up about it. Some things that I tend to think about are, how often are patients thinking about this flaw? Do they mention anything about how it's impacting their life in any way? Have they had multiple surgeries, multiple operations, multiple procedures, multiple surgeons evaluate them for this? Common one is it so small of a defect that they actually have to bring in a diagram to show you it, or you can't even see it yourself? Probably something that's not that obvious of a defect. So these are some of the things that I think about when I'm looking for these kinds of patients, and I very, very, very rarely think it's the right thing to do or the ethical thing to do for us to operate on them, because they really need to be in a sound state of mind. And unfortunately, if they aren't aware that they have this condition, they probably are not in the best state of mind. So again, this is a very serious and real condition that we do experience. And so I want to make all of you guys aware of it. So that way, if you ever come in as a patient and we kind of float you down that track, you understand why. Or if you are a surgeon or another doctor watching this, and you also know how to look for signs of this and hopefully how to steer them in the right direction. So this is Dr. Lexie Wang on this episode of Face the Facts. We are presenting this from West End Plastic Surgery in Washington, D.C. Look forward to talking to you guys next time.